Well, we want to have a conversation today about an important health warning from the state. Measles cases in the U.S. have hit the highest total in 3 decades, and the numbers are growing here in Michigan. So far this year, we've seen 18 cases of measles. Locally, 2 were in Macomb County and 1 was in Oakland County. Whooping cough is also a concern, with 855 cases reported in Michigan. 152 of them are in kids less than 2 years old. It's why the state is pushing for vaccinations. And we'd like to welcome back Dr. Natasha Bagdasarian, the Chief Medical Executive for the state of Michigan. Thank you so much for being with us.
Thank you for having me on.
So why don't we first start, let's talk measles. The numbers are not trending in the right direction.
So this is actually the worst year we've had for measles in the United States since 1992. Measles was declared eliminated in 2000, and we are close to losing that status based on the number of cases we've had this year alone.
What are the numbers like?
You know, when we look nationally, we have about 1,300 cases. A lot of those cases are associated with a large outbreak in West Texas, but there have been cases around the country, including cases here in Michigan.
So what is your first thought? I mean, we've heard the warnings, we've heard the advice about to get vaccinated, but when you see these numbers trending the way they are, what was your first thought?
Well, a couple of things just to point out. Number one, a lot of parents think that measles is just a routine childhood illness. It's just a rash. It's no big deal. And the truth is that about 20% of kids with measles end up being hospitalized.
Really?
So it can be very severe. And a small percentage, just under 1% of children with measles can actually die from measles, can develop neurologic complications like seizures. So it can be a very severe disease. That's the first thing I want people to know. The other thing is it's extremely transmissible. If there was someone in this studio right now with measles and they left, that measles would actually linger in the air for about 2 hours.
Really?
Someone could be exposed 2 hours after that individual left. So very, very transmissible. And the third thing I really want people to know is the vaccine is incredibly effective. When we talk about other vaccines, the COVID vaccine, the flu vaccine, we talk about having a less severe form of the disease if you get these vaccines. With measles, it actually prevents the disease completely. 1 dose is 93% protective, 2 doses is 97% protective.
So how do you reach the groups who feel that they're doing what they can to protect themselves? They are making decisions for their own health and safety. How do you reach them?
Well, I really want people to understand the risks right now. It's important for people to know that measles is on the rise. There are more cases nationally. There are more cases in Michigan. There's another large outbreak very near us in Ontario. They've had over 2,000 cases in Ontario alone. So especially if you are traveling, it's important to make sure you are up to date with the measles vaccine. But also, if you're staying here in Michigan, there's a chance you could be exposed. And this not only impacts you and your family, but it can impact other people as well. And I especially think about kids who are immunocompromised. Kids with leukemia, for example, kids with organ transplants who can't get the vaccine.
Okay, and on that note real quick, you know, for folks who are vaccinated, you hear some of these numbers and then your eyes kind of glaze over because you're like, it's not going to impact me, I'm vaccinated. But you're saying there is a greater public health risk here that could impact you as well.
So absolutely, even if you're immunized, there's a small chance. I mentioned that vaccine is incredibly good, 97% if you've had 2 doses, but make sure you've actually had those 2 doses. Talk to your healthcare provider, take a look at your vaccination records. Don't just assume that you've been vaccinated. And, you know, again, if you have someone in your family with health risks, anyone who's immunocompromised, they could again be at greater risk.
Let's also talk about whooping cough. What are you seeing there when it comes to the numbers?
Again, we're seeing an increase in cases of pertussis or whooping cough. Pertussis is a bacterial infection. It really impacts little ones, so little kids more than older kids, and it causes it's called whooping cough because it causes them to have these paroxysms of coughing where they are struggling to catch their breath and almost make a whooping type sound to catch their breath. And we've seen the number of cases really going up last year and this year. And both of these trends, the pertussis trend and the measles trend, are closely related to fewer people getting their vaccinations.
So obvious question, what is your message then as you see these numbers increasing?
Be aware of the risks, be aware of what these diseases look like, and talk to your healthcare provider. Make sure that you're up to date with vaccines, that your kids are up to date with vaccines. And if you have questions, if you are specifically concerned about a vaccine, if you've been reading things that concern you, talk to a healthcare provider. Get your information from someone who's qualified rather than from the internet.
And on that note, when you are reading online, or it's an influencer, it's somebody you think you know and you trust, I mean, none of this stuff is verified. People are just putting whatever. What is that like when you're trying to do your job, or other doctors and healthcare professionals are trying to do their job?
Well, what concerns me is a lot of people say they want to do their own research.
Sure.
And they're not really doing the research when it comes to looking at data. They're mostly just listening to individual stories.
Yeah.
So you may hear a story that is concerning. You can't tell if that story is medically accurate. And you actually, if you want to look at risks, you have to look at a large number of cases and actually look at the data on a larger scale. So talk to a healthcare provider if you have specific questions about your risks or whether you should get a certain vaccine.
Well, we know you're certainly very busy, top doc in the state. Thank you so much for taking some time to talk to us, and hopefully people will heed your advice and talk to their healthcare professional.
Thank you for having me on.
Thanks, Doc.